Welcome everyone to today's webinar, Enable your critical clinical supply chain with real-time and reactive visibility. On behalf of Becker Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. Today, we're pleased to have Chad Paff, Vice President of Product Management at VPL, and Amber Bielek, the Product Manager at VPL. Equal parts product leader, strategist, and technologist, Chad is passionate about identifying and solving problems through technology with a focus on valuable, usable, and feasible solutions. With his entrepreneurial approach to problem solving, Chad shipped healthcare's first cloud-based supply chain freight management SaaS platform. Chad uses his wealth of experience in a variety of roles and industries to lead various product launches and enhancements at VPL. Amber uses her unique perspective and background in customer success to build supply chain solutions for hospitals and health systems. Realizing her experience on the customer side could help the product team make proactive innovations, she began to look for ways to transform the user experience on the product side of things. Amber is on a mission to enhance the customer experience at VPL. Chad and Amber, thank you so much for being here with us today. I'll now turn the floor over to you.
Thank you. We appreciate you all joining us today. We're excited to talk about the role visibility can and should play in the healthcare supply chain. During today's webinar, we will discuss what rising inflation means for the healthcare supply chain, how freight management has evolved over the years, why it's critical to align clinical operations and supply chain logistics, and how you can do so with visibility, how to digitally transform your supply chain with actionable insights, and the role supply chain technology plays in reducing the impact of inflation. We're going to touch on all these topics today, but before we get started, I wanted to kick off by learning a bit more about the audience here today. We've heard a consistent top 3 focus points for supply chain leaders headed into 2023. So what's the most important focus area for your health system this year? Financial stability, staffing and operational efficiency, or mitigating disruption? So feel free to go ahead and vote. Couple call outs here, financial stability, obviously we're seeing increased financial pressures with inflation. Those financial pressures are obviously severe in most healthcare organizations. Inflation's driving up labor, supply, and drug costs. It's lowering consumer demand. On the staffing operational efficiency side of things, we're obviously seeing a lot of labor shortages, and that results in knowledge drain. Additionally, labor is scarce. Less people are doing the same or more work, and valuable knowledge and experience is leaving the healthcare organizations. Also, there's the expense of healthcare staffing companies. In terms of mitigating supply chain disruption, we're seeing disruptions due to complexity and fragmentation in the supply chain. It's complex, and obviously there's existing systems built for transactional processes, but not necessarily for sharing data or conducting analysis. And providers struggle with access to dynamic supply data from suppliers, which can prevent them from being proactive with demand planning. It can lead to canceled surgeries, which obviously impacts revenue. All right, so from our results here, financial stability, top of the list. No real surprise there. It's been top of mind for everyone. So we'll be delving into that in a little more depth here as we move forward with the webinar. So let's begin by talking about how healthcare inflation has impacted the clinical supply chain. You can see here that the impact of inflation has driven up healthcare costs significantly. National healthcare spending is increasing by $370 billion for the next 5 years. An increase by between 2019 and 2022, labor costs are going way up. We're seeing adjusted rates for discharge growing at 25%, closely followed by pharmaceuticals, 21%, supplies at 18%, and services at 16%. So costs are increasing for healthcare system, but it's also very challenging for patients. This gives us a little bit better visual of inflation's impact on healthcare input costs. As you can see, both labor and non-labor costs are expected to continue to grow in the next 5 years. The effect of this is summed up in an article by the Healthcare Financial Management Association that states, inflation's impacting health systems broadly because they don't control revenue. It's all negotiated with insurance companies or the government. Revenue is fixed and costs for labor, supplies, and everything else are going up. Because of this, providers are looking for ways to reduce expenses, starting and ending with the supply chain. Let's talk a little bit about the evolution of freight management. So over the years, started with really the unmanaged freight programs. So health systems were not using a freight management vendor to gain access to discounted carrier rates, manage freight costs, and identify cost savings. This led to unpredictable and high costs. There wasn't a designated person within supply chain operations who was tasked with monitoring freight and supplier costs. Additionally, there were the inefficiencies of having a lack of workflow. Then along came freight management as a service, which is what many health organizations still use today. With this model came less unmanaged freight and reduced costs, but it still has critical restrictions, including inefficiency of allocation, no visibility, being locked into a single carrier. What many health systems may not realize is that service-based third-party logistic companies are hard-coded into one carrier with masked costs and margin-based models. If it ever sounds like you're being double charged for inflation, it's because you are. With a margin model on freight spend, you're charged more by both the carrier and your third-party supply chain partner. You're charged double for needing things quickly. You're charged more for larger parcels. You're charged more. Gas prices are high, so think about $2.64 per gallon up to $3.49 today. And you're charged more when carrier rates increase, which happens every single year. Not all inflation is mandatory, but with a traditional service-based partner, you'll always spend more than you did the year prior because inflation is literally baked into your contract. So what's the alternative? Aware of the issues and restrictions, VPL rethought the old service-only model about 4 years ago. And by doing so, we built the first and only healthcare supply chain visibility platform that will replace this traditional form of freight management. It provides transparent control costs, real-time and reactive visibility, clinical alignment, access to multiple carriers, and with this model, you change supplier dynamics and establish a resilient supply chain. We pride ourselves on transparency, especially when it comes to costs. We are priced by software license based upon the number of shipments specific to your hospital. We aren't benefiting from various shipping methods, fuel increases, carrier annual price increases, or size or weight of your packages. Why is it important to have access to multiple carriers? Well, inflation affects them too. Here's a look at the average cost per shipment over the last 2 years, pulled directly from our supply chain visibility platform. The top two lines represent Express, the bottom is Ground. We've seen some of our customers ship Express more often than they necessarily need to in order to get their products on time. That's a dream for traditional supply chain management solutions because they take a percentage of your freight spend and Express shipments are more expensive. Because many healthcare supply chain leaders are locked into a single carrier per their contract, they may not realize that inflation varies by carrier. VPL is the only partner that has access to this data because we're the only partner that lets our customers use both major carriers. We do this because it's important to us that our customers have access to the lowest rate per shipment and delivery. You can really see here the volatility of a single carrier over the last year especially. Without an alternative carrier option and the data needed to clearly analyze the performance of your supply chain, this is your bill.
Before we address the inconsistencies in on-time deliveries over the last couple of years, please rate your confidence in on-time deliveries at your hospital. 1 being no confidence in ordering duplicates just in case, and 5 being confident and predictable. I'd like to share one of our customer stories as you answer. We have a well-known customer in the Midwest who struggled with lack of visibility into on-time deliveries. Their main distributor continued to have delayed shipments into one of their main hospital locations. After reviewing data, we identified the carrier that was not delivering their shipments on time, and the data helped drive conversations with their carrier rep. After driving those conversations, their carrier rep shared that there was labor shortages at one of their main sorting hubs, and this was causing their shipments to be delayed. This information helps our customer feel confident in requesting their distributor ship using an alternative carrier method, which improved their on-time percentage of shipments. And it goes back to the importance of having access to multiple carriers, which VPL supports. The majority of our customer base ranked number 3 in their confidence level of receiving on-time shipments. I'm going to pass it over to Chad to dive into the importance of having access to multiple carriers for delivery performance.
Great, thanks, Amber. We know that all carriers do not perform equally when it comes to costs, but there's also significant fluctuation in carriers and on-time delivery. We pulled on-time delivery trends between 2 primary carriers over the last couple of years. In this chart, you can see the dramatic fluctuation in on-time or early deliveries of critical clinical shipments. Not only is one carrier more consistent, but also consistently outperforms the other. This reactive visibility allows you to plan ahead, selecting the carrier and shipping method that'll ensure that your clinical products will arrive when you need them to. There's power in having choice, and this is just one example of that. This leads us into what's next in the world of freight management. Creating a supply chain that is situationally aware, collaborative, smart, real-time, and clinically aligned. In order to achieve this, we need to inform procurement at the time of order. We need to change supplier dynamics, drive clinical integration, and sort this shift to at-home care. First-generation freight management is standing still because it's all it can do, whereas software opens doors to a future of innovation, resilience, cost savings, and clinical alignment. We all know the healthcare industry has typically been slower than other industries to adopt new technologies, and supply chains often overlooked as a potential area for innovation. However, as inflation continues to pressure health system finances, it's becoming increasingly clear that old supply chain models won't cut it in today's fiscal environment. Rising inflation is pushing providers to realize the need to create a more situationally aware, collaborative, and flexible supply chain. And according to Gartner, care is moving to new venues, and consumers and patients continue to be engaged in new ways, enabled by advancing technologies and innovative vendor solutions. Healthcare provider CIOs should use these predictions to prepare for continued healthcare access and affordability challenges. We want to show you what advancing technologies and innovative vendor solutions look like from a supply chain perspective and how it can help improve your hospital margins.
We're about to dive into why it's important to align clinical activity to supply chain workflows. Before we do that, we'd like to get a better understanding of how often your health system is experiencing disruptions that impact patient care. Please select from one of the following options: daily, weekly, or monthly. In 2020, VPL commissioned a survey on the effects of visibility, or lack thereof, in the healthcare supply chain. 83% of the 192 respondents stated that they believed it's important to know the date, time, and location of PPI deliveries, yet half of these say they rarely or never have this information. 76% of all respondents didn't know if product would arrive on time for a scheduled procedure, and 84% of all respondents have seen procedure delays due to back orders in the previous 12 months. Ooh, looks like we have a tie here. So the majority of our customer base feels that they experience disruptions that impact patient care on a weekly and monthly basis. I'm going to pass it back over to Chad so that he can dive into how important it is to have real-time visibility.
Thanks, Amber. At the onset of the pandemic, a VP of supply chain at one of the largest healthcare systems in the US called our CEO on a Saturday morning and told him, "We don't have visibility into our orders." He asked for our help. So we quickly put together a team supported by manual processes and spreadsheets. We found that while this problem was put under the microscope by the pandemic, it's become an even bigger issue today due to broader supply chain issues, labor shortages, and other factors. As VPL discussed, researched, and learned about these challenges, we narrowed down to a specific problem: wasted time and expense. Our supply chain visibility platform was created to combat repetitive time-wasting workflows for supply chain and clinical users. On average, a phone call from a buyer to a supplier requesting the status of a shipment takes over 20 minutes. That can really add up. Buyers can be spending 50% or more of their day tracking down the status of shipments. clinical staff can be spending 10% or more of their day tracking shipment status. For clinicians, time spent chasing down the status of a shipment is time not spent providing care to patients. In terms of costs, a study by a large health system found that $45 per order is spent tracking down order status. Here's the problematic workflow we're trying to solve for. All of our hospital customers said the same thing. They want that Amazon-like experience. They want to know where their stuff is and when it'll arrive. Today's workflow, the clinician calls or emails their supply chain team to request the status of a shipment. In turn, the supply chain team calls or emails the supplier and or the carrier to request status of a shipment. Oftentimes, this results in a lag where the supply chain team is left waiting for an answer from the supplier or carrier. If the supplier or carrier doesn't respond, the supply chain team is forced to just keep waiting until they get an answer. Here's what we produced, a streamlined workflow, that Amazon-like experience, if you will. With visibility, the clinician calls or emails their supply chain team to request status of a shipment. The supply chain team can even subscribe the clinician to receive automated real-time status updates via email. Optionally, the clinician can log into the platform directly to check the status of an order, further simplifying the workflow and reduce costs. This quote from Gardner emphasizes how critical it's becoming to align clinical operations with supply chain logistics to deliver efficient and cost-effective healthcare. A few reasons as to why we agree with this statement. Clinical alignment increases patient safety by ensuring healthcare systems maintain a sufficient supply of products. This also creates an opportunity to discover which clinical products are interchangeable to clinicians, as well as understanding other attributes that matter to them. It reduces overall costs for health systems and patients, and it improves clinical outcomes. An ideal solution lets supply chain and clinical staff search by PO, tracking number, product, or buyer, track and monitor shipment status and delivery on a map, subscribe to email notifications for proactive alerts, share order status with clinical staff. I want to give you a preview of what that visibility and collaboration can look like. To show you it's not all smoke and mirrors, this is our user interface. The main dashboard provides a configurable view of what the buyer clinician has ordered, what's been shipped, what's been ordered and not shipped, what's delayed, and which shipments are critical. Users can search for shipments by purchase order number, product, or buyer. Users can also filter their shipments by supplier, delivery address, estimated delivery date, and status. They can also save filters to quickly and easily identify the shipments they're most interested in. After selecting a shipment, you can see how we provide that Amazon-like experience for buyers, clinicians, and even dock receivers for their products with detailed ETA when they're asking, where's my stuff? You can see your shipment on a map along with the estimated delivery date that is updated in near real time. You can also increase the visibility of your most important shipments by marking them as critical, which will highlight them on your dashboard. Additionally, you can opt in to receive email notifications when the status of a shipment changes so you can easily stay on top of your most critical shipments without having to reach out to a supplier or carrier. Finally, you can share shipment updates with your workers via email to further increase the efficiency of your supply chain operations by providing access across your organization. So this improved workflow resulted in immediate visibility into shipment status, reduced calls and time spent on the phone with carriers and suppliers, improved staff and clinician satisfaction, and it also provides an early warning system when a product may not arrive on time, which allows for earlier contingency planning to reduce the risk of impact to a procedure. Built in collaboration with our customers, we recently released a new feature to provide visibility into oncoming deliveries at hospital receiving locations. This lack of visibility makes staffing the receiving dock challenging due to inconsistent volume of parcels. Additionally, this lack of visibility means the amount of space required on the receiving dock floor is unknown. When an unexpectedly large delivery arrives, the receiving dock team scrambles to create enough space for the packages. This results in adequate resource and space planning. VPL's supply chain visibility platform now provides advance notice of how many packages will be delivered by receiving location and carrier on a map, along with the total volume of the packages. As a result, receiving dock managers can effectively staff their receiving teams based on the number of expected shipments. Larger deliveries can be quickly and efficiently received into inventory. Smaller deliveries can be received by fewer workers while allowing other team members to be reallocated to other projects. Receiving dock teams can prepare the right amount of space to receive deliveries. All right, with improved workflow efficiencies in mind, let us know which of the following has the most impact on your supply chain. And you can select all that apply. Immediate visibility into shipment status, operational efficiency, so less calls and spent on the phone with carriers and suppliers, improved staff and clinician satisfaction, reduce risk of impacting a procedure with early warnings for contingency planning, and improved resource and space planning for receiving dock teams. So here is a couple call outs around each of these. So with visibility into shipment status, obviously, if you can understand when products will arrive, that's critical for effective planning. With operational efficiency, we talked a lot about the time buyers and clinicians are spending reaching out to suppliers. Knowing that averages on 20 minutes per interaction, that's a lot of time that adds up and it incurs quite an expense. From staff and clinician satisfaction standpoint, we know that many of our procurement teams have KPIs directly related to customer satisfaction based on surveying their internal customers. So that's a big deal for them. In terms of reduced risk of impacting procedures, obviously we know that procedures are a primary revenue generator for health systems. So avoiding delays and cancellations is critical. Having a backup plan for supplies and equipment is definitely a must there. And then from the resource and space planning perspective, we've heard a lot of call outs from our receiving and logistics team about that lack of visibility into what's coming in on a day-to-day basis. So staffing is ineffective sometimes. They can't resource plan well, and space planning becomes a real challenge too because some of their receiving areas are constrained in terms of space. Let's take a look at those results. All right, looks like reduced risk of impacting a procedure with early warnings for contingency planning is number one. Not a big surprise there. All right, by providing clinicians with insight into order status and movement of vital product from manufacturer to point of patient care, our supply chain visibility platform mitigates risk, lowers costs of care, minimizes time wasted tracking product, reduces the long-term impact of disruptions by buying you time for a plan B, which results in fewer delayed procedures. It helps ensure health systems are maintaining a sufficient supply of critical products, and it allows you to put a greater focus on delivering better patient outcomes. Gartner reports that by 2026, 20% of healthcare providers will adopt real-time health system supply chain platforms driven by the need to more closely align supply chain logistics with clinical activity. As we can see, cloud-based healthcare supply chain platforms are becoming more critical in the creation of real-time health systems. But this goes beyond visibility.
Let's transition to focusing on digital transformation. The future of healthcare supply chains will be heavily dependent on leveraging data and analytics to identify cost savings opportunities, to counteract inflation and inventory planning to optimize overall patient care. Gartner recently asked healthcare providers how they would describe the primary objectives of their enterprise's digital technology investments in the last 2 years. As we can see, operational excellence, resilience, and innovation have been top of mind for supply chains. In 2023, VPL is starting to hear cost efficiency as a primary driver again. Let's talk about how you can leverage data and analytics for continuous optimization of your supply chain management program. VPL has built a data product solution because we understand that data drives cost savings and that healthcare providers struggle to gain a comprehensive view of all data associated with how products move into and throughout their health system. We also knew customers were overspending on inbound freight, and with a lack of visibility, it makes it harder to correct it. Let's quantify the problem a bit more. On average, most customers are overspending by at least 20% for inbound freight and on average 30% for outbound freight, in addition to spending up to 1.5 times more per unmanaged shipment. After understanding our customer needs, we created a data solution to provide actionable insights into cost savings opportunities through inbound, outbound, and supplier data. The inbound dashboard, which is what we're looking at here, provides shipping data to monitor shipment volume and spend over time. The inbound dashboard also identifies mode optimization opportunities for ongoing cost savings. So for example, by providing visibility into one-day first shipments, you can identify if those shipments could have been shipped one day AM with only a difference in 2 hours of arrival time within your health system, but significant cost savings. One of the most appreciated features is the supplier dashboard, which encompasses our customer supplier data. The supplier dashboard enables customers to drive conversations with suppliers by identifying suppliers who are shipping outside of the VPL program in order to increase compliance and reduce prepay and ad spend. We also expose supplier fees and how they trend over time. This is yet another bucket of potential uncontrolled cost in a traditional program. This information equips contract managers to review their contracts to see if suppliers should even be charging their health system these fees, or it gives data to potentially negotiate these fees upon contract renewals with vendors. We discussed how our platform can provide data to drive cost savings, but now let's dive into how our platform mitigates disruption risk. We use historical data to provide insights into shipment delays and disruption trends, total order times, lead time to ship by supplier, and supplier location. Let me show you how it looks on our platform and dive a little bit deeper into how these metrics work to mitigate disruption risk. This visual from our platform is sharing metrics we provide for visibility into shipment delays and disruption trends by carrier and carrier service level, thus enabling you to identify how our carrier is performing with the percentage of late and percentage of on-time shipments at your health system locations by vendor. This information helps root cause which carriers may be underperforming, equipping you with the data necessary to request vendors potentially switch carrier shipping methods, and helps drive carrier conversations. This data also identifies how late certain service levels may be arriving within your health system. So for example, one-day first shipments are arriving at the same time as one-day AM shipments. Knowing this information, and it will equip you with the knowledge to reduce cost by requesting those vendors ship one-day AM over one-day first. We also provide total order time data to help mitigate disruption risk. This information will help supply chains understand how long it's taking a supplier to fulfill orders and how long it's taking a carrier to deliver those orders. Several of our customers wanted to understand supplier lead times. So how long is it taking suppliers to fulfill my orders? We provide that information by supplier and supplier location, since one supplier location may be performing better over another. This data is going to help buyers communicate to clinicians on average how long an order might take, provide trending to determine whether to order from a different supplier if one's underperforming, and potentially help better plan inventory par levels, which also affects clinical operations. Chad, I'm going to pass it back to you to speak on how VPL can help reduce the impact of inflation.
Thanks, Amber. Technology has a quicker reaction time than service-based models. Cloud-based solutions also provide the data and visibility needed to counteract supply chain disruptions, including environmental, geopolitical, and economic. As we know, the medical sector has been facing a significant rise in transport costs and longer and more predictable delivery times. Because VPL offers choice of carriers along with analytics to measure carrier performance, VPL can direct suppliers to use carriers that provide the best combination of cost and on-time deliveries. Additionally, VPL allows customers to track their inbound shipments without reaching out to supplier representatives. This can potentially reduce the costs of inbound support calls for suppliers. That's a big win for them. You can see how many shipments will be delivered to receiving docs to better staff and plan accordingly. You can access readily available data for mode optimization opportunities to reduce freight spend. You can evaluate supplier lead times. So how long is it taking suppliers to fulfill my orders? You can evaluate carrier performance. So how often is a carrier delivering my products on time via standard overnight? Should I switch my product orders from standard overnight to priority overnight to reduce costs? VPL can help you create the real-time health system needed to deliver efficient and cost-effective healthcare to all patients. With our healthcare supply chain management technology, you can access real-time visibility with track and trace functionality, align supply chain logistics to clinical activity with reactive visibility. You can choose between multiple carriers, FedEx, UPS, USPS. You can leverage performance data for future optimizations and ongoing cost savings. You can reduce the impact of inflation, and you can drive operational efficiencies and guaranteed savings year over year. Our smart supply chain platform is designed to change the dynamic of communication, collaboration, and data exchange between providers and suppliers. If you also believe in our vision, we'd love to have a strategic conversation. You can connect with us at hello@vplmail.com or visit our website at getvpl.com to schedule a demo. Thanks for your time today, and I'll open the floor for questions.
Thanks so much for that, Chad. I will get started with a few of the questions that we have for you guys. First, does using cloud-based technology come with added security concerns? If so, what are they, and how does VPL protect against them?
Yeah, great question. Obviously, security is top of mind for all of our customers, especially in the healthcare field. For us, using cloud-based technologies transfer some of that security risk to the vendor. So to mitigate this risk, VPL evaluated the vendor security program and third-party security certifications and attestations to ensure that our security policies and procedures are aligned with the cloud vendor and that we're in great shape from a security stance.
Thank you. Next, how will the shift of care out of the hospitals and into homes affect supply chains, and how are you preparing for this trend?
That's a great question. I'll take that one. So to answer the first part, supply chains will be tasked with ensuring products are being planned, ordered timely, and delivered directly to patients to increase the overall patient experience. It's going to be critical to have visibility into the movement of products from the point of order from a supplier, and then you're going to want to have shipment visibility all the way to the end point of care within a patient's home. VPL is preparing for this by having a clinically minded software-based shipping solution optimized for the healthcare industry. Hospital at home impacts specialty pharmacies significantly, and we've developed a pharmacy solution that offers software that integrates with existing workflows, mitigation of human error, visibility, including downstream proof of delivery, which is huge for pharmacies, the reduced need for package rescue, especially with those increased expensive specialty prescriptions that are being shipped, reduced automated updates for product status to patients, on-demand analytics, and a customizable list of carriers and couriers.
And as a follow-up to that, how long do you expect it'll take this program to get up and running?
We work really, really hard. Our implementation team has worked hard to create an efficient onboarding process, and on average, our customers are taking around 30 days to get up and running after contract signature.
Great, thank you. Next, do you offer any support related to internal site-to-site deliveries?
Yeah, I'll take that one. That's a great question. Today we don't, but this is something that's on our product roadmap. So I've been having a lot of conversations with our customers about this and some of the requirements and challenges in that area. So we're looking at this as a potential future feature. Great question.
Excellent. In the VPL dashboard, you mentioned the word critical. How is critical defined?
Yeah, another great question. So today in our platform, you can go in, when you search for a PO, when you see your result, you can mark any shipment you'd like relative to that PO as critical. And at that point, you have a filter that'll show everything you've marked as critical, and it'll keep it there for you until that product is actually delivered. So it gives you full line of sight through the life cycle of leaving the supplier all the way to your receiving location.
Perfect. Thank you so much. And I just wanted to check and see if anybody has any more questions before we wrap up. All right, no more questions. You guys were perfectly thorough. I want to just thank Chad and Amber for an excellent discussion and Vantage Point Logistics for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you so much for joining us today, and we hope you have a wonderful afternoon.
Thank you so much for having us.
Thank you.